Hi, my name is Casey Cisco, and this is my third speech, the informative speech for the public speaking course. Today, my topic is cardiac resynchronization therapy, or CRT. This is my audience, which consists of 5 people and my dog. This may come as a surprise to you, but approximately 3 million people worldwide are implanted with pacemakers, and each year 600,000 more receive one. Typically, the average age for a patient receiving a pacemaker is 60 years of age. However, anyone at any age may require a pacemaker. Pacemakers are usually used to treat an underlying arrhythmia called bradycardia, which is when the heart beats too slow. However, there are also a pacemaker that is used to resynchronize the heart, to thus make it beat more effectively and more in sync. Today I'm going to be explaining cardiac resynchronization therapy, or CRT, and how it can be effective in treating patients with poor cardiac output. In January of 2015, I was fitted with a cardiac pacemaker for an underlying arrhythmia. The issue that I was having was from my sinus node, and it was being dysfunctional. I was having cardiac asystole due to my sinus node dysfunction. I was having pretty severe symptoms prior to receiving my pacemaker, and once I had it fitted, I have no longer had any issues. Cardiac resynchronization therapy can be a very effective way to improve the heart's rhythm and the associated symptoms caused by the underlying arrhythmia. Today I will be discussing the biventricular pacemaker, or cardiac resynchronization therapy, how CRT works, who is CRT eligible, and a recent clinical study. First, I will discuss the CRT device itself. There are 2 different types of heart failure devices, the CRT pacemaker and the CRT pacemaker with defibrillation therapy. Both devices are used to help improve the heart's pumping function. The device itself has 2 or 3 leads that are positioned in the right atrium, the right ventricle, and the left ventricle via the coronary sinus vein. The device itself is like a tiny computer with a battery contained in a small titanium case that is about the size of the pocket watch and weighs 3 ounces. The leads are insulated wires that are connected to the cardiac muscle. These leads send information from the device itself to the heart, or vice versa. The third part of the device is a programmer, which is located in your physician's office. This programmer is used to program information to the device and change the settings on your pacemaker. I will now explain how cardiac resynchronization therapy works. CRT is used to help improve the heart's rhythm and help reduce the symptoms of the underlying cardiac arrhythmia. CRT is used to treat the delay within the ventricles that can occur from advanced heart failure. This arrhythmia is called a bundle branch block. CRT may help to improve the pump's performance and help reverse the process of ventricular remodeling. CRT is recommended for patients with end-stage heart failure, systolic dysfunction, or a prolonged QT interval. Patients with heart failure typically describe moderate to severe symptoms. There was a recent clinical trial performed by Dr. Saxton and Dr. DeMarco that described how CRT can greatly change a patient's life. Their main point was how there was a positive symptomatic benefit and delayed mortality in patients who received a pacemaker. The name of this trial was the Miracle Trial. To summarize, CRT can be a very effective way to help improve the heart's rhythm and treat the underlying symptoms associated with a cardiac arrhythmia. Today I've discussed the biventricular pacemaker, or CRT device, how CRT works, who is CRT eligible, and a recent clinical trial that shows the positive effects of CRT. Thank you.